How was your childhood, Mr. Gilbert?
I may say I was brought up and I grew up in a rural environment. Yeah, that was Gitega, Burundi, and then
Gitega is great.
Yeah, it's great, but I was not based in the central town, so I was living in the rural area of Gitega.
That was Mutaho, right?
No, that's not Mutaho, but it's in Gitega actually, Gitega commune.
Okay.
But in a rural part called the Mungwa zone, can actually achieve our dreams no matter where we grow up, no matter what we are going through. So it's really a matter of doing what we are doing and doing it best. Thank you very much. Thank you once again for hosting me. So just a brief introduction. My name is Gilbert or Gilbert Ndayishimiye. It depends on how you want to pronounce my name. So,
let's say Gilbert.
Yeah, Gilbert. I think you said easier and for everyone just to actually they want to repeat it once again. So I'm a Burundian. I don't know. I'm married, a father of 2 kids, one boy and one little girl. So I did a paramedical school that was in Gitega, yeah, and then I did my bachelor's degree at NSP, as I said, and then after that I had to go to work, and then in the meantime, so I had the chance to be trained by Harvard University and the University of Washington. For Harvard University, it was all about trauma and how actually do we overcome trauma? How does trauma actually leads to some severe, especially in refugees, how does it actually lead to mental health issues, and how do we actually make sure that we prevent that from happening? So designing, I like humanitarian interventions, things like those ones. So then I was trained by University of Washington, that was in leadership and management, in global health mostly, and also I was trained in global mental health. That was all the way understanding how, because mental health is something global. There's some particularities in their cultures, because for the Western world is different from the African context. So yeah, another thing, then I was also trained by University of Washington again in project management. Yeah, and then after that I went to the Netherlands where I was trained. That was in actually a total different field, but it was very important because actually it was related to what I was doing. It was actually on maternal child health. So maybe someone listening would be like, how does maternal child health relate to mental health? But that's another thing that we've been discussing about. Yeah, because those are also subject to mental health disorders. Then after that I moved to Hungary where I did my master's in public health, and now here I am. I'm training Burundian health professionals. Yeah.
How did you feel the first time that you are admitted to being trained at Harvard University? What was the feeling?
It was a remote training, though. I need to mention that. It was a remote training.
Which is good, by the way.
And I was like, oh my goodness, because I had to meet other professionals virtually. And then I was like, oh, am I joining this actually big network like this ones? Because those are the people actually who make us who we become. So you don't meet people by accident, but there's always a reason why you meet people. So I was like, oh, this is a dream. I was like, I will get something out of that. And I know that probably I'm not yet there, but I still out of that I will get where I want to be.
You've worked in intense fields, psychiatry, emergency settings, addiction. What's one moment in your journey that really tested you? How did you find your way through it?
That's a very interesting question. I think that happened when I was leading a project. I led a project actually that was all about, screening mental health disorders among school-age kids who. That was a school-based initiative, and then we had to work with school heads of school, and then because it was likely something new, because we had to how can I call it? It was actually to adapt a screening tool, which is called Pediatric Symptom Checklist. It's actually an international tool for screening mental health disorders for kids and adolescents. So we had to bring it to our cultural context. And then what happens is like the school that actually was supposed to host the project at a given time, they said, no, we are no longer interested in that thing. So, but they had a valid reason, though. They had a valid reason, like, if you do this and then at a given time, you publish results like we have so many people in our school with mental health disorders. What are people outside there are going to say about our school system and everything? So they had a valid reason, but the point actually was for them to understand, what's the good reason behind the project.
Yeah.
It was not actually to expose them, but it was the aim of the project was to make sure that we detect mental health early so that we prevent severe cases. But then after just discussions, because, life is all about, communications, discussing with people. And then finally they understood that we really needed to carry on that project. And it was a success.
Tell us, Mr. Gilbert, what is mental health?
Mental health actually... by introducing it, you actually mentioned something very important, because we do really misunderstand what mental health is. But according to World Health Organization, mental health actually is mental well-being that actually enables people actually to cope with the stresses of life, and most importantly to realize their abilities and actually be able to learn, work, and especially contribute in the life of their communities. But it goes actually beyond, because there are some cultural concepts that we need to take into account, and when it comes to mental health, and also just not as a limit, but religious beliefs that actually shape the way we think, the way we process ideas, the way we process whatever happens in our daily lives. Because as I know, there's a lot actually happening in people's lives.
That's
and
true.
Everything that actually happened from, where you work, where you live, where you grow. So it's all about mental health. Yeah.
That's interesting. I'm really loving this. To find yourself doing mental health classroom, teaching that and doing that, I think it's something that we've been following it for so long.
Yeah.
Can you just take us back a little bit to Mr. Gilbert, if it was private?
Yeah.
How was your childhood, Mr. Gilbert?
I may say I was brought up and I grew up in a rural environment. Yeah, that was Gitega, Burundi, and then
Gitega is great.
Yeah, it's great, but I was not based in the central town, so I was living in the rural area of Gitega.
That was Mutaho, right?
No, that's not Mutaho, but it's in Gitega, actually, Gitega commune. Okay. But in a rural part called the Mungwa zone. If those who know Gitega, they were easily actually located this neighborhood. And then I got a chance to actually to live in town when I was actually attending my secondary school after primary school. And then I really got a good grade. And then I was actually appointed to go and study at the Lycée of Gitega, as where I did my secondary school. And then that's where I actually become exposed to the real world and a different environment. So, but talking about mental health is not like something that I always wanted to do, but I think it was shaped by a kind of lived experience, not a personal lived experience, but it's just something that happened to one of my friends, actually, who because now I'm a professional that I understand what was happening. So I think back then he developed a kind of bipolar disorder, and then he was desperate, and then the family didn't know what to do, and at that time there are no we didn't have enough mental health centers or hospitals that actually could take care of such medical conditions. And given our Burundian misbeliefs around mental health, so it's like they need to take you to traditional healers, they don't want to take you straight forward to the hospital or to look after a mental health professional. So the family really struggled until they found a way actually to take me to the neuropsychiatric center of Kamenge, where actually I think he spent there around 6 good months. Actually, he had even to miss, a whole school year. That's imagine. So, and then I was like, back in the time then I wanted to go to university, and then I thought, what should I do? Because I'm a trained and registered nurse as well. And after that, because I was like, I need to do something at the university. I was thinking, what else can I do? And I was like, I think I can try mental health. Given what happened to my friend, I was like, I think I need to address this gap that actually shows up here, especially here in our country. Yeah.
Do you think like me or any other person watching this should care about mental health or their mental health?
They should. Everyone should actually care about their mental health. But unfortunately, we don't do. And it's something that most of the time we do ignore, like, it can't happen to me. But I think there are some reasons, actually. One would be that people don't know about mental health. They feel like that's why it can happen to me. But I think the most important reason is the stigma around mental health, because there is a really lot of stigma around mental health. People are stigmatized. People, in a professional, environment, even, schools, everywhere, and in their families, because if they have someone who have a mental health disorder, it's like, it's a curse on the, for the family. So, but something that we really have to understand is, there's no one actually who is immunized against mental health disorder. Anyone actually can get any mental health, problem. So, but we don't care, and something happens to us, and then we feel like we are coping. But the other thing is that we don't actually look after mental health professionals. We have a lot of psychologists actually who are available, who can help us, but they don't. Like, we think that we can manage by ourselves, but sometimes it's very important that we meet mental health professionals actually to support us, to guide us through, whatever we are going through. But sometimes we might think that we are going through something small, but what we call small sometimes can actually have a longer term.
That's true.
That's where, when we develop severe mental health disorders, that's where actually we think like, we should consult. Something is wrong. When the outsiders actually start noticing that something has changed, it's where I think, maybe we need to take him to the hospital. We need to take him to see a psychiatrist, something like that. But for us, it's something that actually, comes in slowly. We know we don't care, and then I give it time. So there is something big which is already there. So yeah,
that's interesting. And Mr. Gilbert, as a mental health professional, to each and everyone who is watching this, may I say, like, if I see these signs, these are red flags that really am encountering mental health disorders.
Oh, thank you very much. That's very tricky questions, because like mental health disorders most of the time actually not find a straightforward cause actually that, can lead to a given mental health disorder, but there are, some theoretical background around it. I think that is what I talk about. Mostly it's shaped by, what I can keep it a bit short. Some by psychosocial causes. There are some biological causes that can lead to mental health disorders, such as a drop in dopamine, for instance. Those are biological processes that might be very hard actually to explain to lay people or to people who are not really in that field. But there are some actually associated with some genetic background as well. Because like if in given family, there are some people, for instance, who developed like bipolar disorders or schizophrenia, for instance, there is a likelihood or there is a risk for other people if they are exposed to other, psychosocial conditions that lead to such disorders. But as I said, there are those also psychological causes and social causes that, as I mentioned before, because like mental health is all about what we live in, what we do, how we are treated from our childhood, even, back when we are still in our womb of our mothers, what is happening to our mothers actually, what affects the mother also affect the fetus. Our mother is abused during pregnancy, when she's pregnant, that also has an effect.
Child can be
exactly. Yeah, exactly. So those are the things sometimes we ignore, but that really exists. So I just to keep it a long story short, those are the main reasons actually that can. But there's something that is actually common, and then based on experience, because I've been practicing mental health here in Burundi for around more than 6 months, so which means that I know actually what brings people consultation room. So there is something common, especially in young people, which is all about drug abuse, or in a more professional way, we call it substance abuse, where people are drinking a lot of alcohol. Young people are smoking a lot, whether weed or cannabis, and there is many other psychoactive substances that young people actually are abusing without knowing that actually it's a threat for their mental health. So it's really something that we really need to address, especially back in our families.
I think life starts with the conception, I think, in the womb, right? So you said that a child can be affected. Imagine a husband watching this, and I have a wife who is something like 3 months pregnant. How would I take care of my wife until she gives birth to the baby?
Okay, I'll emphasize a little bit that particular point, because actually when it comes to life cycle, if I put it like that, so it's actually the person, it starts when actually the couple is planning to have a kid. That's where a human being is born.
Can you come again? What do you say?
Someone is born when the family, couple, the mother and father are planning to have a kid. Because they have that kid already. So the way you are ready, the way you get ready, to have that kid, is actually, what do you have? What do you need? Do you really need that kid? That's so much, because there are some couples over there who are struggling to have a kid. There are some also kids that be like, hey, how did you add this small boy again? We thought probably you were done. And we're like, this one came by accident. It's not an accident. But the way actually, there are some biological processes, psychological processes actually, even what do you feel? What are your feelings regarding the newborn? Because if you probably were like, I'm done with having kids, and then little Alex is there. So imagine then you feel like, oh, what? But I didn't need the Alex. I thought I was done. So it starts from there. Actually, the feelings, how do you take care about this baby? And most of the time it raises some concerns that really need to be addressed, because this goes to families. If a kid is there, they should be proud of the kids, because it affects them. The way the mother takes care of herself while they carry someone, when they feel like it's very special.
That's true.
It's totally different. This is, I didn't even need this one. So you understand. So it's really very important that we understand this concept. So then, to that question again, it's a matter of how actually it's supposed like the way you treat a pregnant woman. It's also supposed to be like during the pregnancy. It's supposed to be like during the whole, your daily life. It has to be your daily life. Not only just waiting, when the wife is pregnant and then it's like, I should be treating her special because she's pregnant. No, because as I told you, what we live in, our daily lives, it doesn't really have to start from there, because what has happened before, again, can play a critical role, like in future mental health, issue that someone would, develop. So it should be actually a good lifestyle, an understanding within the family, living in harmony, actually in a caring environment, and then, everyone is good to go. See. Yeah.
What do you do when someone comes and they tell you, Mr. Gilbert, I have a person, maybe elder brother, younger brother, and they're going through something like mental health disorders? Yeah. What would you do to that person?
We do have some specialists, but they are not really so many like they're supposed to be, but there are some who are available, and unfortunately we have a lot of psychologists who are actually not really involved into straightforward in mental health, but we do have some professionals. So it's very important when you encounter someone who is struggling by mental health issue, actually to let them know that there's some professionals out there that can actually assist them, can guide them through because some, as I said earlier, so as long as we delay, that seeking the help, the more it becomes very severe. And then when it becomes very severe, then it's really has a lot of consequences. So we really need to make sure that we have early access to treatment, mostly specialized healthcare. Yeah.
That's interesting. Can culture hinder practicing mental health? Is this something that is like a hindrance to you, mental health professional, to practice it here in Burundi?
I might just say happens not for health professionals or mental health professionals, but actually for patients, mental health patients. Because as I said, for instance, there's a lot of stigma around mental health. So, and then because of that stigma, sometimes people do not actually, they don't come to the hospital. They don't come and are, to have their issues addressed by mental health professionals. Because if someone knows that, if someone gets aware that I'm struggling with a mental health disorder, they are going to laugh, at me. That's one thing. And then, you prescribe something, and then it becomes very hard because there's some medications that we do here you use. Sometimes some of them, they have some side effects that you cannot hide. That they'll be publicly noticed, and then people will actually know that this particular person is taking psychiatric drugs. So those are the barriers, those are the cultural issues we do have, which are hindering the whole process. But again, personally, back to how our mental health system is organized is another issue, because for me, I believe that we shouldn't have private hospitals. Mental health services should be available in all hospitals. They should be included in the primary health care, whereby if I go to the health center, I should be able to meet a mental health professional. I don't have to go to Rojanti, as we call it, just to meet a mental health professional. I should go to the military hospital and be able to meet a mental health professional, because that structure actually is, I would call it a structural, stigma. Because if I immediately go to the Lujanti, everyone will know that I'm suffering from mental health. But it's not supposed to be like that. So those are the things. And it's not only in Burundi, especially if we talk about stigma, it's all over the world. It's all over the world. Yeah. So that's, I think, one of the way out is actually to have it integrated into our general care system, so that will actually reduce this cut. But there's also other things that sometimes we need to address. Are those beliefs, cultural beliefs actually around mental health. It's very important to emphasize those ones, because we still have some negative beliefs around mental health, whereby a lot of people, they still believe mental health issues, they cannot be treated at the hospital. It's you are cursed. These are demons. What did I? These are not demons. People should be taken to the hospital, and then those who get there, they get help. So, those are the other things that we really need to address.
Because I think there are young people who are watching this, and they say, Gilbert, and he has got, I think, a very interesting journey, and would like to become like him in some ways. But I don't know the cost. I don't know what it takes to become that person. How did you become that Gilbert that we see today? Or any message that would like to send to a younger Gilbert, 15 years old in Mungwa, right?
Yes.
What would be that message?
Actually, it's all about finding what you want to become in your life, and actually pursuing your dreams. Say like, because like in life, sometimes we can have dreams, big dreams, but sometimes it's then you have to live them in reality. It becomes sometimes very hard. So, but what you need to do, if you are passionate about something, you always find a way out, and sometimes, it might be not easy. Maybe you wanted to be a mental health professional, but you find yourself in IT or something else.
Yeah.
But there's always something that you can do wherever you are, in whatever field you're in, but you can still relate it to your dreams. So it doesn't necessarily mean that you need to be trained in that particular matter, that particular field, actually to do something around it. So wherever you are and whatever you are doing, you can always find a way to pursue your dreams, to make your dreams become rich. Whatever background we do have, wherever we are, I think we can dream, and then we can actually aim high. It doesn't actually matter where we are, but it's also all about, I remember when I was first, told someone who actually commended me for Harvard training. So I was like, is it me or someone else? So, and then I was like, oh, can this happen to me? So, it's all about doing what we are doing and doing it best, because you never know who is watching you. So it's never know. So these are the things. So in whatever we're doing, just do it best. You don't know who's watching. There are some people actually who are admiring you. They are not even telling you. Not those who come straight forward and tell you you are doing a great job, but there are other people actually watching you. So as I was telling you, someone was like, so I see what you are doing. You are doing great. And then I think you should be trained by Harvard. I was like, sure. Yes, I was like, yeah, I think you can. Then I was like, oh my goodness. So, which means that we can actually achieve our dreams no matter where we grow up, no matter what we are going through. So it's really a matter of doing what we are doing and doing it best.
Thank you so much, Mr. Gilbert, for coming. It is a pleasure to have you here.
Thank you, Setback Podcast, for hosting me. It was really a pleasure for me. That's the reason when I invited him, I was like, yeah, why not? I will be present. Yeah, thank you very much. And I really appreciate the conversation. That if you want me one more time, that if I'm available, then I'll always show up. Thank you.
I think I'll be loving to have you, even in the future. Thank you so much, Mr. Gilbert.
That will be my pleasure. Thank you very much.
You're welcome.